This is case of the day, and we have the 133rd case today, diagnosing the etiology of Addison's disease. This 41 years old presented with Addison's disease, and the endocrinologist referred the patient for a PET CT, and you can see bilateral adrenal active lesions. There was no other pathology. So, what are the differentials? And I'm not an expert in body imaging below the diaphragm, but I do biopsies. And just from a practical perspective, there are tumors and there's granulomatous disease. The tumors would be functioning adenomas, metastases, lymphoma, and then TB or histoplasmosis. Now, uh, functioning tumors, etc., would be sorted out by the endocrinologist. Adenomas would not have uptake and would not cause Addison's disease. So you're left with Mets, lymphoma, TB, histoplasmosis. The PET didn't show a primary. So let's assume, therefore, that Mets is out. And the lesions are not really bulky the way you would get with lymphoma. And to get isolated adrenal lymphoma is also quite uncommon. Common in our country is to have granulomatous disease such as TB and histoplasmosis. So, how do you get to the diagnosis? And you really have to biopsy the lesion. So, in this patient, using an 18 gauge Cook 10 millimeter throw long 15 centimeter needle, took about 11 minutes. So, here's the needle. Um, this was angulated a little bit out of plane, but not without gantry angulation, so that I could reach the adrenal gland here, bypassing the kidney. You have to give some local anesthetic when you touch the diaphragm so that the patient doesn't flinch and the breath hold doesn't go out of whack. And here is the deployed gun through the needle in the in the left adrenal gland. Got two cores for histopath, four for microbiology, and three vials. So two were for gene expert and one for culture, one for fungal. The gene expert was negative, but the histopath today was unequivocally caseating granulomatous disease and therefore tuberculosis, and therefore that is not histoplasmosis. Now, both are common, and histoplasmosis in India in the adrenal glands occurs even in those who have never traveled outside India. And I did one post at ctbiopsy.com, the URL is here, of this patient who had these brown pigmentation due to Addison's, had bilateral large adrenal lesions, biopsied the left one, and the patient had classic histoplasmosis. Just for those who are interested in adrenal gland biopsies, you can do them in the prone and decubitus positions. Very rarely, if the lesion is very large, you might use the supine position. And I have in the past, many years ago, used the transhepatic approach, but nowadays I find that I can usually figure out a way in the prone or the decubitus position. So just a few of these. That's the prone perivertebral going mediolateral. This patient had Addison's and this was tuberculosis. This patient had a left adrenal gland, which was a colon primary mets, and I went lateromedial, posterior and posterolateral. That's the usual one. So, if in the prone position the lung and the diaphragm come in the way, then I will use the ipsilateral decubitus position where the lesion is down. This patient also had Addison's. This turned out to be tuberculosis. And just once, when the patient's breath hold was bad and the patient was anxious. In fact, this patient, we had sedated the patient, but in this one, um, we couldn't get a good breath hold for ipsilateral, and I actually used a contralateral decubitus with a little bit of hydrodissection and was able to get in. And I know I have colleagues who would have probably gone transhepatic to do a biopsy, and that's fine. But I thought this was just a more elegant way and not having to violate any organ systems. And this was metastatic adenocarcinoma from a lung primary. So, just in summary, this is a short one. If you have bilateral adrenal nodules and Addison's disease, it's usually granulomatous disease, lymphoma, Mets. And if a PET, and as you've seen, a PET is done pretty much in every patient, and patients do get convinced to get it done. If a PET is negative for disease elsewhere, then typically lymphoma and Mets are both out. And so then you're just basically looking to do a biopsy to differentiate between TB and histoplasmosis, and of course, very rarely neoplastic disease. So Bilateral adrenal nodules in our country, PET showing only adrenal lesions. It's TB versus histoplasmosis, and the best thing to do is a CT guided biopsy. And those are the various routes that I've shown. That's the rat protect. Usually for people who've never attended this before, so first, second year residents, and some consultants who missed doing this earlier. My WhatsApp channel. Thank you so much for viewing this.